And thank you for staying with us. Doulas are an important part of the delivery care team. They provide physical, emotional, and informational support to a mother before, during, and after childbirth. Now, due to COVID-19, hospitals restricting patients to only one support person in the delivery room, also cutting off all other visitors in order to minimize the spread and the chance of contracting COVID. Well, what steps and actions are being taken right now to help doulas support and interact with patients? We're pleased to be joined by a very special guest, and we're pleased to have Dr. Ameena Ali, and she is the founder and the lead advocate at the Federation of International Gender and Human Rights. She joins us as our guest here on Open. And Dr. Ali, good to have you.
Good to be here. Thank you so much for having me.
Thank you. I do know that it is very challenging, especially in the hospital situation right now. As we said, with COVID and COVID restrictions, you only are allowed pretty much that person to come in. So, talk to us a little bit about giving childbirth and how doulas have had to really make adjustments during this season.
Well, a lot of it has to do with personal care. The person-to-person contact, of course, with COVID is running the risk of mom contracting it, and then new baby with no immune system contracting the virus as well. Breast is best, and it has the greatest antigens and basic subsidies to build the milk, build the immune system, and build the immunity in the baby. So while baby's newborn, it really doesn't have anything for 28 days. So it's always best to treat the baby as though it has no immune system, similar to someone with cancer, someone that has a compromised immune system because of age or because of the understanding of a health disparity. So you always want to make sure that the person-to-person contact is limited. So the hospitals have put in very, very strong, very stringent rules and regulations as to who can go in and when they can go in. So that means who can go in, who is going to be the less viable to give or contract the virus. And then when they can go in, we can't have them in there all day, every day, going in and out, going back and forth. You have to either stay in there or leave. If you have to leave, they're going to ask you to redo your contamination procedures. And this is very key as a first responder and having women come into care while they were pregnant. This was very, very needed because women were saying that they were coming down with the virus and couldn't bond with their baby. So in the very, very beginnings, we were noticing the disparity in having the women be distant or maybe even wear a face mask with their newborn. So we realized we had to put other protocols in place and make sure that the babies are safe and mommy was healthy.
Right. And so talk to me about maternal health during this time. I mean, very important, very key, very critical. What kind of advice were you giving mothers for maternal health?
Yes. Well, first of all, we're educating them. As we know, COVID-19 is really COVID-2, back when we had SARS, if everybody remembers that. So we're understanding what the virus is, and SARS is COVID-2. So we're taking the mutated piece and we're trying to work variables around it. So we're trying to get the vaccine, we're trying to get standards of care, and of course, avoidance of the contact through washing the hands, through skin-to-skin contact, and then through face-to-face contact, which is why we're wearing face masks. The second measure we're doing is we're involving the people. We're not pushing the fear factor in this. We're making sure that you understand what you need to do. So that means keep your family healthy and well. Make sure that daddy and other siblings are well before birth. Don't wait until the birth and then try to invade them with vitamin C tablets. We need to make sure that their upkeep is going well. So mom has 10 months to have baby. So if she was pregnant within that COVID region, we're going to make sure that daddies are healthy, that parents are healthy, that siblings stay healthy, and that the contact is minimum with mommy so that it doesn't run the risk of them contracting it without knowing it and giving it to mommy. So we did a quasi-isolation thing where the children only had a few hours a day to be with mommy, and then we would separate them, and then we would get them used to mommy being away from the children, because mommy, when she has babies, she was going to be away from the children anyway, just for quarantine reasons. And that would have been the first 14 days of the baby's life. We're going to eliminate contact. We're going to eliminate too many visitors. We're not having any outside visitors. So whoever was there at the time that mommy gives birth is the only people that'll be allowed in her room. So that's why we put protocols in place. And then we asserted mommy's care. So, once we did the education, we did the instruction, we gave mommy care. So we made sure she had masks. If she contracted the virus, we made sure that if she got sick or ill in any way, that we helped with the symptoms so that baby can be skin to skin as quickly as possible, as soon as possible. And we also made sure that baby was well, making sure that if mommy had COVID when she was pregnant, that baby tested negative for COVID, and made sure that the parameters were in place to keep baby negative for COVID after baby was born.
Yeah. And I want to talk a little bit about racial disparities, because that was huge, right? We know that the racial disparities affecting African Americans during COVID, and particularly communities of color that suffered the most casualties and also are the most susceptible, the most vulnerable population. I know that you've done some work in testifying and being an advocate. I know in 2019, you are the representative for the International Model UN Association, and also a member to the International Human Rights Commission in Geneva. And so you do a lot of advocacy. Talk to us about being that voice, especially for the voiceless in a time like this.
Yeah, I was the squeaky wheel before COVID. I was the squeaky wheel when people were talking about job disparity and making sure pregnant women got a place to go back to work once she had the baby and that type thing. So I think my squeakiness is effective, ongoing. And when COVID hit, it was very, very passionate. It was very personal to me, because women of color, Black and brown women, are always at the bottom. They are the ones left behind, pushed behind, and labeled as other and not important enough to be included in dynamics of data. So it was very, very important to me to get them out there first. So we were putting together programs on wellness, oddly enough, catching a cold, the virus, or the flu before COVID. I remember, I think I caught the virus in January when Kobe died. And this was when they were labeling it upper respiratory infection. And I remember canceling an event because I had to go face to face and I didn't know what this thing was. Well, it wasn't until like a week later, once I felt better, I was convalescing about 10, 12 days. So it was, maybe 2 weeks later, I came back and I remember saying, I got to do a thing on wellness, because if this happens to me and I have to sit down, imagine what is happening to the pregnant women. No sooner than I did that, 3 weeks later, we're in the middle of COVID. And I remember the women telling me, Ameena, that was right on time. And it wasn't like I did it, with some kind of osmosis. I did it because it happened to me. So one of the things that we're doing is advocating based on personal experiences. And we're making sure that all voices are heard in this to make sure we get the care that we need. And then we are who we've been waiting for. So that was a huge piece. I pulled a piece of Barack Obama in this, because we have to advocate for ourselves. I remember back in the days when we didn't have to go to doctors and hospitals and go to the police, and we handled things internally. And we kind of lost that over the years. I remember being raised by the block right there in Brooklyn, New York. And I remember having the woman down the street chastise me just as quick as my grandmother or my mother did. So we have to get back to that understanding that we have to protect each other. If you know somebody's sick, you're going to bring something to make them feel better. You're going to feed them, or you're going to give them a tincture or a salve or something that's going to make them feel better. And we're going to get back to what we know as a community by doing things together. We don't need medicine to become healthy. We have to practice wellness. So we're educating, informing, and we're making sure that the communities are definitely in the front lines of the cure as they are with the illness.
Got to be our brothers and our sisters keeper. Dr. Ameena Ali, we got to leave it there. Thank you so much for joining us here on Open. And certainly the information is there for people to be connected to. Keep doing the great work.
Thank you. Thank you for having me. And thank you for allowing this conversation to happen.
No, thank you. All righty. Dr. Ameena Ali, our guest here on Open. We want you to stay with us. We do have more show coming up right after this.